Hey there, this is Dr. Liz Hafer. I want to talk to you guys about retracing. Retracing is a very interesting phenomena that we see in upper cervical. It's not new to chiropractic. It's actually rooted in homeopathy, and basically any natural healer will see that when you do something to correct somebody's physiology, you're going to see a healing result from that. So I kind of want to start off with talking about a really interesting report that was published out of King's College in London, and it was just a recent study done this May of 2016, and it talked about cellular healing and the epigenetics of understanding how cells can manifest trauma or disease generation after generation. And if you understand cellular healing and cellular memory, you can understand retracing. So it's neat that there's finally science being proven that it validates what we've always known in chiropractic, that we have innate intelligence that dictates and determines how our bodies are going to heal or go down the road of dysfunction. So in retracing, I guess what I really want you to understand is that when you apply a correction to somebody and then their body holds it, they're going to go through a systematic way of unwinding and untwisting and untorquing. And it's a musculoskeletal healing, it's a neurological healing, and that goes all the way down to the cellular healing of the person. So when you understand that retracing is about going from the dysfunction that they present with back to maximal optimal function, you can help the patients understand that it's a process and that their innate intelligence is what directs it and is what is guiding the process to full function. So when you understand that retracing happens because the person is holding their adjustment, it helps you to better educate the patient on how they're going to heal, what they're going to be experiencing through the healing process. And the most important thing to understand in the beginning is that retracing occurs immediately following a correction and as long as they hold a correction, and that the most vital things that need to be, I guess, fixed first for the survival of the person is what's going to heal first. And then it goes through chronological order. So if you had a whiplash injury when you were 15, and then you had a football injury when you were 17, and then you sprained your ankle when you were 25, the most crucial thing that your body's going to retrace through first are things that are detrimental to the survival. So once those things get fixed, then old symptoms can and will heal. And you may feel during a retracing cycle the old injury, the old sprain in your ankle, the old whiplash that you experienced as a teenager. That's why it's important to get a good health history, understand where people have been, understand what they've walked through from a physical and emotional and a chemical standpoint, because all of those things absolutely affect their ability to hold corrections. And it's like clockwork. Once you get an adjustment, every 90 days from the initial date of correction, you go through retracing cycles. And the first cycle that you are in is 6 weeks long. So it usually takes 6 weeks for the patient to really get through that initial healing process with the ups and downs that occur, and then they're stable. And then at 3 months, 90 days after their first correction, they go through another cycle, and that lasts 3 weeks. And once they get through that 21 days, they're more stable. And every single time you go through a retracing cycle, your body plateaus at a higher place of health. So you start wherever it is that you start, and then you go through these little cycles every 90 days, and you eventually come to the point where you don't really experience many symptoms. Your body is very stable and you hold your adjustments well. What I've noticed about retracing is that during the retracing time, patients come in and they kind of regress back to the initial thing that brought them into the office, and they almost maybe show up in pattern. When you're doing a Titron scan, the leg checks can almost check as if they're subluxated, but you have to be very cognizant about where they are in their healing process. You don't want to make the mistake of adjusting somebody when they're in the middle of retracing, because that creates instability. It almost messes up the nervous system, and it kind of doesn't allow that innate intelligence to have full run and do what it needs to do. So you're going to have retracing cycles every 3 months. They're going to be 6 weeks for the first one, 3 weeks for month 3, 3 weeks for month 6, and they're going to be a 6-week cycle at month 9. And generally speaking, I've heard it said that for every year you're subluxated, you can expect 1 month of retracing. So if you meet somebody and they've come in and they're 40 years old and they've never been adjusted, they've never held a correction, you can tell them it's going to take a couple of years for your body to get through symptoms and really get to the bottom of stability and neurological integrity. And you can encourage them that through the process of healing, that when they're expressing health in that way, that their body's doing what it needs to do because their innate intelligence is directing it and dictating it, and it knows exactly what your body needs. So we don't want to do too many things to interfere with that. We also don't want to do nothing and not support them. So it's important to give them information so that they know that what they're doing is okay. Retracing is a really cool thing. There are posters and information that we can find online about it. We can give it to our patients. And I really hope that this helped you get a better grasp about what retracing is and how important it is to have it philosophically grounded in your practice as an education tool, and how you can use it to help be a better doctor and educate your patients on how to understand their health and really embrace it when they are going through these periods of challenge, if you will, during their healing process, because it can get rough and you have up and down days. You have days where you feel phenomenal, and then there's days where you feel like you got hit by a Mack truck, and it all has to do with the body's ability to heal itself. And they've come through a lot of things to get to your office, and once you get them stable and they hold and they heal, that's what we want to see. So I wish you the best of luck getting those atlases to hold, and I hope that you guys get to experience retracing and get to experience the joy of educating patients about it. I hope you guys are having an awesome day.